Welcome to Understanding How to Navigate the Health System, a Guide for Citizens. This is the fourth module where we'll cover care for select populations. My name is Christina Madison and I'm the scientific lead at the McMaster Health Forum, and I'll be walking you through this module. Different populations or groups of people have their care delivered in unique ways compared to other Ontarians. Children, refugees, people with disabilities, and transgendered people. To understand how the Ontario health system is organized to deliver care for select populations, we will look at one population whose care is organized differently from the rest of Ontarians. This population is Indigenous peoples. Indigenous peoples in Canada are made up of three diverse groups: First Nations, Inuit, and Métis. Historically, there have been important distinctions made between status and non-status First Nations peoples and on and off-reserve First Nations peoples. Of the 1.4 million Indigenous peoples living in Canada, the largest proportion, 22%, and number live in Ontario. Indigenous peoples account for 2% of the province's total population. Significant differences in health exist, both within and across Indigenous communities and compared to the non-Indigenous population. For example, higher rates of type 2 diabetes, cardiovascular disease, and mental health and addictions, along with lower survival rates from cancer.
In the land that is now known as Ontario, 14 different nations existed before contact was made with European settlers. Indigenous peoples are made up of three distinct groups: First Nations, Inuit, and Métis. Ontario has the largest proportion and number of Indigenous peoples of any Canadian province or territory, and Indigenous peoples represent one of the fastest growing segments of the provincial population. While the relationship between European settlers and Indigenous people began as a partnership, it has evolved into one of colonization and cultural dispossession. Legacies and past policies of ongoing racism have meant that there exist large economic and health disparities between Indigenous peoples and the non-Indigenous population. For example, life expectancy is shorter and avoidable mortality rates are higher among Indigenous peoples. While the health status of Indigenous peoples tends to be much worse than non-Indigenous peoples, current strategies have tried to adopt a more positive approach to improving health that is rooted in Indigenous ways of knowing, self-governance, and control.
There is a complex range of programs and services available to these groups. Status First Nation peoples living on reserve have access to federal, government-funded programs and services. Status First Nations people living off reserve and Inuit have access to some federal government-funded programs and services, and all three groups, First Nations, Inuit, and Métis, have access to the same programs and services as the rest of the Ontario population, and to some programs and services designed specifically for Indigenous peoples. It's important to note, though, that geographic location, among other factors, can make accessing these programs and services difficult.
The places where care is provided and the people who provide this care are generally the same for Indigenous peoples and non-Indigenous Ontarians. However, there are specific people, including Native healers, chiefs, elders, knowledge keepers, and translators, who work either independently or alongside health professionals to deliver cultural and linguistic supports for care. Some professionals providing services to Indigenous people may work in settings such as Aboriginal Health Access Centres, Friendship Centres, or healing lodges. Some of the products and services that might be covered through private insurance or out-of-pocket payments for many Ontarians can be paid for, in the case of Indigenous people, by the federal government-administered non-insured health benefits.
Indigenous peoples have access to federal programs and services depending on their status and location. As Ontarians, Indigenous peoples have access to all of the same programs and services available in the province. However, geographic location, among other factors, can make accessing these programs and services difficult.
Indigenous peoples have access to the same services as non-Indigenous people. However, at times, geographic locations of Indigenous communities make accessing some of these services quite difficult. In addition to the coverage from the Ontario Health Insurance Plan, a number of target services have been designed to address health disparities and to support the provision of traditional medicine. This includes health and wellness programs, crisis intervention and healing services, and a Healthy Babies and Children program.
This concludes the module. Up next, now that we understand how the Ontario health system varies its delivery of care by condition, treatment, and population, we will review the building blocks upon which the Ontario health system is based.